Hi all, welcome to this evening's webinar on how to lower your blood pressure quickly and safely. My name is Andy Sheppard and I'm the clinical lead here at Redicare. And Redicare are delighted to work in partnership with LloydsPharmacy in bringing you this webinar. And indeed, we're delighted to partner with Lloyds in delivering our online lifestyle program, which is called Redicare Control, which I'll talk about briefly later on. So just a little bit about Redicare, so you know who we are. We run a digital therapeutic service that provides online programs designed to prevent and treat chronic illnesses such as high blood pressure, type 2 diabetes and pre-diabetes, overweight and obese conditions, and high cholesterol. So in this evening's webinar, which will take about 15 minutes, and we'll do a Q&A session at the end. And just on that point, feel free to type in your questions into the questions tab at any point during the presentation so I can get to your questions first when it comes around to the end. So I'm going to cover the causes of high blood pressure, what the latest science has revealed, and what strategies are clinically proven to lower blood pressure. So let's take a quick look at what exactly we're referring to when we say blood pressure. And simply put, blood pressure is the force exerted by the blood against the blood vessel wall. So it's measured in millimoles of mercury. So when you hear somebody say my blood pressure is, and they give you that figure 120/80 or 130/90, the 130 refers to systolic pressure, which is the pressure on the way out from the heart. So the heart squeezes the blood out. When that's checked, the pressure in millimoles of mercury in the arteries, it's known as your systolic pressure on the way out. And then the way back in is known as diastolic. So that's the recoil back in when the blood's coming back into the heart. Now, you'd hear the words hypertension and high blood pressure used interchangeably all the time. And essentially, they're the same thing. So hypertension is another name for high blood pressure. And it's a really serious condition because it can lead to severe complications and increases the risk of many diseases. So high blood pressure is often referred to as the silent killer. And the reason it's referred to as the silent killer is because you can have high blood pressure or hypertension for years without any symptoms. And even without symptoms, so while you're asymptomatic or without symptoms, that damage to your blood vessels and to your heart can occur. And uncontrolled high blood pressure can lead to lots of serious health problems, including eye complications, kidney failure, heart attack, stroke, osteoporosis, and dementia. So I think this graphic really brings home how dangerous high blood pressure is. So these bubbles represent the risks leading to premature death. So all the different risks that can end your life quickly or prematurely. And the bigger the bubble, the higher the risk of death. So we often worry about things like, you know, somebody getting into a car accident or picking up an infection. But in this illustration, we see that high blood pressure is the largest risk factor for premature death. But the good news is that it can be reduced significantly by some simple lifestyle changes. And I'm going to cover exactly what those are in the coming slides. Now, interestingly, when we look at this slide, the majority of the major risks in this illustration here are actually all lifestyle related. So they're kind of bracketed in the red there. You can see high blood pressure, smoking, high cholesterol, obesity, physical inactivity, and alcohol. The vast majority of those risk factors you can do something about, so they are modifiable. So this next slide is really interesting in the midst of all this kind of coronavirus pandemic, because brand new data from Wuhan in China has shown that certain underlying health conditions place you at a far higher risk of poor outcomes from coronavirus. So one of these health conditions which places you at a higher risk, and it's the top one that's highlighted there, is hypertension, which we discussed in the previous slide is another name for high blood pressure. So now more than ever, we've been faced with the reality that high blood pressure can place us at an imminent increased risk of death during the outbreak of a virus such as COVID-19. And we need to address the lifestyle factors that contribute to high blood pressure now more than ever. Now, the great news is, so like I was saying, I'm the clinical lead here at Redicare. We've researched this stuff thoroughly for the last 5 years or so. And the understanding around what causes high blood pressure and so how to treat it has become much, much clearer in the last couple of years. And I'm going to lay out exactly what you need to do in the coming slides. So let's take a look at the key root cause in all of those chronic conditions, actually in the previous slide, from heart disease, high levels of cholesterol, pre and type 2 diabetes, and blood pressure. So from a pathophysiology or a root cause point of view, what's in common with all of those is something known as insulin resistance. I'm going to get a little bit sciencey here for a slide or two, and then I'm going to go through what steps you need to take to correct your blood pressure. So numerous studies have demonstrated that something known as insulin resistance is a key player in high blood pressure. It's huge. So insulin, first of all, before we talk about insulin resistance, is just a hormone that your pancreas secretes when you eat carbohydrates, in particular processed refined carbs like bread, cereal, granola bars, rice, pasta, frozen pizza, sweet cakes, anything that tastes nice, basically, any of those things. Your pancreas secretes insulin. And if you do that repeatedly over a long period of time, your body becomes resistant to the action of insulin. So basically, it doesn't understand that insulin isn't doing its job, keeps making more and more and more, and that can cause an awful lot of damage. So the foods that lead to insulin resistance the most are processed, refined carbohydrates. And we'll talk about those foods more in a slide that's coming up shortly. So I'm just going to show you a little deep dive on the science and the mechanisms at play when it comes to blood pressure actually occurring. So you may have heard that salt causes or can lead to high blood pressure, and that's true in a sense because high levels of salt can lead to high blood pressure. But let me explain a really important factor within that process, and that factor is, again, insulin. So there's two main ways that high levels of insulin from processed food and insulin resistance can lead to high blood pressure. One is through weight gain and obesity, so extra downward pressure around your internal organs, visceral fat it's known as. So that can put direct pressure and increase your blood pressure because of the added weight. But that's not always the case because you've got people who are the normal weight as well and have high blood pressure. Another main way is through increased sodium retention in the kidneys. So basically, when you become insulin resistant, what insulin does to the kidneys is it instructs the kidneys to retain salt within the blood vessels. Now, this is a crucial point, that water follows salt, fluid follows salt. So the fluid goes in to deal with the salt inside in the arteries, stays within the arteries, and you have a bigger volume of fluid in the arteries, which increases the blood pressure. So if we piece that together once more, because it's a key process to understand, high levels of sugar from processed food or overall carbohydrate intake being quite high from processed refined carbs leads to consistently high levels of insulin. High levels of insulin leads to higher sodium levels because that's what it instructs the kidneys to do. You get more water, more fluid into the blood vessels, and then you have increased arterial pressure or increased pressure within the arteries, which is high blood pressure. So that's a really important concept to understand. So now that we understand what exactly is going on from a blood pressure building up point of view, and we know that processed foods, and in particular refined processed carbohydrates and added sugars, lead to high levels of insulin, let's take a look at how we can apply this to our food choices and lower blood pressure quickly and safely. So the foods we need to eliminate, without question, the most effective ones to remove are your breakfast cereals, your granola bars, frozen pizzas, crisps, and desserts. And for the longest time, 30, 40 years, we've had this kind of myopic focus on everything being low calorie and low fat. And we've indulged in processed, refined foods only to realize in the last couple of years that actually those very foods, even if they're lower in calories, if they have sugar, processed carbohydrate, grains, cereals, all that stuff, causes your body to spike that hormone insulin, which leads to a high insulin state and can cause high blood pressure. So an important point to note here is that all dietary carbohydrate is metabolized as glucose. Now, aside from insoluble fiber. So I'm not talking about fruits and vegetables necessarily. Maybe starchy veg, but not most fruits and vegetables. I'm talking about processed food. So I define processed food as any food with more than 3 or 4 ingredients in it. So that absolutely includes breads, pastas, and so on. They will absolutely contribute to high blood pressure because they'll cause the body to secrete higher levels of insulin. So a hugely effective way of lowering your blood pressure is to follow a whole food eating protocol or a whole food eating plan, which focuses on removing these processed foods that spike insulin and replacing them with good quality fats and a moderate amount of protein. So a good example of these sort of foods would be free-range eggs, avocado, grass-fed meats, low-sugar fruits like raspberries, blackberries, blueberries, strawberries, and vegetables which are lower in sugar. So Ideally not your starchy veg like potatoes, sweet potatoes, your lower sugar veg, dark chocolate, and so on. So they're the main dietary steps, guys. In terms of the dietary approach, the most important thing to consider is that you need to reduce your overall blood glucose level, because it's the blood sugar levels that cause the body to secrete that hormone insulin that contributes to high blood pressure. So the focus doesn't need to be so much on salt. Salt plays a part if you have high insulin, but if you don't have high levels of insulin, it's nowhere near as important. Refined sugar is really important to get out. So that kind of Coke, again, we've had this focus on calories. It might be 100 calories, but that will do so much more damage to your body than, we'll say, half an avocado, which has the same amount of calories. So another key tip is to quit smoking. So smoking will raise your blood pressure, it will cause damage to your arteries, it causes that what's known as intra-arterial damage, and quitting must be a key part of lowering your risk. Another key factor in improving your what's known as arterial compliance, or the ability for your arteries to expand and restrict, which is hugely important for blood pressure, is exercise. So to my mind, one of the most effective, safest, but also most underrated exercises for blood pressure management or hypertension management is exercise, or is walking, excuse me. So I would walk maybe 3-4 days a week, hugely important to get your blood pressure under control. Alcohol is another one. So alcohol can aggravate high blood pressure, and cutting down is definitely necessary when you're looking to control your condition. And then finally, you might benefit from supplements such as a high level omega-3, which ideally is high in EPA and DHA. They're just the active acids in it that help your body to absorb it. CoQ10 and manganese. And in certain cases, medication may be required too, so make sure to talk to your GP in relation to that. So guys, dealing with blood pressure is something we have a huge amount of experience with at Redicare. And as I was saying at the start of the webinar, Redicare runs a digital therapeutic service that provides online programs which prevent and treat chronic illnesses like high blood pressure, type 2 and pre-diabetes, high cholesterol, and overweight and obese conditions. And a big part of what we do at Redicare is clinical validation, and we publish our results, we publish all our data, and typically what we see is a reduction in 8 weeks of about 11 or so millimoles of mercury in systolic blood pressure. And to put that into context, that's enough to take you from having high blood pressure to having what's known as pre-hypertension. So it can pull you down a full grade. Now, you may want to do our program to lower your blood pressure, but we see a range of other health improvements, including significant weight loss without counting calories, without being hungry. Patients lose approximately 6 to 7 kgs in that same 8-week period and see significant improvements in blood sugar levels and cholesterol levels. So as I was saying at the start of the webinar, guys, we're delighted to have partnered with LloydsPharmacy because we feel they're an ideal partner, being such a progressive and forward-thinking organization with a great connection to their local community and to their customers. So to register for our program, guys, if it's something you'd be interested in, it's really affordable. I'm just going to jump on here and show it to you. The registration link is at the bottom there. It's controldtx.com/LloydsPharmacy, and I'll flash that up in a second once I've just shown you some of the features on the program. So we'll just take a quick look at some of the features. Now, our users have access to a range of features, including custom delivered educational videos, unlimited access to one-to-one phone or Skype health coach consultations, a peer support forum, which acts as a kind of a members forum, and a range of recipes, meal plans, shopping lists, and visual food guides. So essentially, it's everything that you need to get your blood pressure under control, to lose your weight, and to optimize your cholesterol levels. And we regularly update our content and run live webinars like this one, weekly video posts, and recipe cooking videos too. So in terms of the pricing, guys, if you did want to get started today, it's very affordable. The registration link is up there in front of you again. So it's €50 for the first month and $14.95 per month thereafter. And that price includes all the meal plans, shopping lists, cooking videos, and unlimited access to one-to-one health coach consultations, either by Skype or phone. There's no long-term contracts, and you can cancel hassle-free at any time. So if you did want to get started today, and we'll go to Q&A shortly, just log on to www.controldtx.com/LloydsPharmacy and we'll get you up and running straight away. So guys, thanks a million for taking a few minutes to listen to me here. I wanted to wrap it all up in kind of 15 minutes or so, but we'll go to a Q&A now. So if anyone has questions, please pop them into the question section. They don't necessarily have to be about blood pressure. It can be about anything at all. So pop your questions in there and we'll do a quick Q&A for 5 minutes and I'll let you guys get on about your evening. Couple of questions in already. So is it possible to lower blood pressure without losing weight is the first question. Okay, that's a great question. So there's a misconception out there that in order to lower your blood pressure, you need to lose weight, and that's not necessarily the case at all. In fact, we've seen numerous case studies where somebody didn't lose weight and lost their blood pressure. The misconception comes from the idea that people who are metabolically unwell have high blood pressure because they're overweight, and that's not the case. In fact, there's a new sort of a cohort of patients now that they're referring to as TOFI, which stands for thin on the outside, fat on the inside, who have a lot of visceral fat and end up with high blood pressure because they're insulin resistant. So I personally have treated a couple of patients where they didn't lose weight, so we kept them on what's known as an isocaloric protocol, meaning that we kept their calories the same and lowered the insulin in the body by reducing their intake of processed refined carbs and feeding them a whole food diet. The blood pressure lowered and they didn't lose weight. So it's a good question, but yeah, it absolutely is possible to lose weight without, to lower your blood pressure without losing weight. Is the sauna useful? I heard it raises blood pressure. Great presentation, thanks very much. Okay, so is the sauna useful? So when you hear that the sauna will raise your blood pressure, that's actually in the short term, and it will raise your blood pressure. That's part of your body's adaptation response, is to raise up your blood pressure. But to say or to assume that that's automatically a bad thing would be misleading, because your blood pressure goes high when you're exercising, and you would never make the claim that exercise is bad for you. So your body has an adaptive response. So that's known as a hormetic stressor. So hormesis, H-E-R-M-E-S-I-S. Hormesis is a short-term stress that your body is under that elicits an adaptation response, which is better for your body and your health in the long run. So exercise, fasting, cold exposure, sauna, they would all be examples of hormesis. What are your thoughts on metformin for blood sugar control? Okay, someone very, very informed. Metformin for blood sugar control is something that you'd be prescribed by a GP, by a doctor, to lower your blood sugar levels, and it's effective. And of course, that's up to the GP to prescribe that and the person to take it. If you're not diabetic, I don't see any reason to take it. So metformin can lower your blood sugar levels, but a much more effective and safer way to do that would actually be to follow a whole food diet that's lower in processed refined carbohydrates. So to eat less bread, cereal, granola bars, fizzy drinks, biscuits, and then there would be no need for the metformin. Okay guys, listen, thank you so much for taking the time out of your evening to hear me talk for 15 minutes. I really do appreciate your time, and I'm looking forward to doing more presentations and webinars like this over the coming weeks. So again, if you do want to get signed up on Redicare, and again, we're delighted to partner with Lloyds. Our program is available. You can get registered straight away on it. It's controldtx.com/LloydsPharmacy. Guys, have a great evening and thanks again. Take care. Bye-bye.